Taylor? Did we already white balance?
Yeah, you're white balance. You're good to go.
We did? Yeah, you can turn the brightness up a little bit if you want. Okay, Hannah, it's Dr. Buford. We're just getting started on the right knee here. We examined your knee before we started just to check the ACL, and that's great. And you had an endpoint, and you did not have a positive pivot shift test, which is a test we use to also assess knee stability. And so now we're just getting our first look in the medial compartment. Up above here is the femoral condyle, down below is the tibial plateau. And you can see how this plateau is a little bit spongy. It gets a little bit firmer out more medially here. Okay, now as we look at the posterior horn of this meniscus, back here, that looks pretty good. It feels stable back there. And this is consistent with the imaging we had that did not show a meniscal tear. So we're going to save the ACL for last. And we'll look over here in the lateral compartment next. This is the lateral meniscus. And then we'll bend the knee up just a little bit, see if we can't get a better look at the posterior horn of that lateral meniscus. Right there. And just like on the medial side, this meniscus is checking out okay. The surfaces of the tibial plateau down below look good. Femoral condyle up above looks pretty good. So I'm happy with the way that looks. We'll go ahead and look up at the patella. We'll push in just a little bit more. You can see there's a little bit of what we call the fat pad in our way. And that looks pretty good. We're seeing all the way over to the medial facet. Here's the lateral facet. Right in the middle is a part of the knee called the trochlea. And we can track this all the way down the front. Okay, so that looks good all the way down the front. Okay, so now we're going to go back and we're going to look at the ACL in just a minute here. Okay, so here's the ACL. We can look down at the tibial insertion here. And we can see where this looks pretty good coming off of the tibia. We can see some of the vascularity in it. And we can see that it's running up basically in the proper direction. We can hook it, we can check the tension on it like that. There we can see back through to the back of the knee. And so what we're going to do is take a 25 gauge spinal needle and get to work here. This is the posterior cruciate ligament back behind here. As we reach behind your knee and give a little bit of forward displacement, we can see if that ligament tightens up. Hold the camera right there for me, 2 hands, yeah. Right there. Okay, right there. That looks pretty stable. So we'll go off in the video, show you some more in a minute. Okay, so here's our little spinal needle coming in. You can see it here. We can start at the base, right here. And we'll start with our PRP. Keep that right there, please. And let me see the PRP. Hold the camera here. This does not hold a lot of volume. And you can see as we pull out and continue injecting, if you look at the ACL, you'll see it there. See, look at the blood vessels moving a little bit as we inject. Okay. So far we've put in just a total of 1 cc. Can I get a 22 gauge? Okay, so now we've got a 22 gauge needle. You can see the location there. As long as we're inside the sheath, you can see there's nothing leaking out into the joint. So we'll try a little bit here. Just turned our water pressure down a little bit. Okay. We're going to go all the way up to the insertion in the back. I'm hitting the wall there, so I know where I'm at. You can see the graft move as I inject right at the femoral origin there. And now we've put in a total of about 2.5 cc's, and I think I'm going to stop there and put the rest into the joint. You can see it's basically full. So we're going to turn off the water, put the rest into the joint, and then we're going to get you back to the recovery room. So I really hope this does the trick for you, okay? Good luck to you now. Bye-bye.